Hello, doctor. We're back.
Hello, we're back.
What are we going to talk about today?
Vitamin D. So I woke up this morning and there was this CBC article on how vitamin D is a waste of time to supplement. And I was like, what? I was like, okay, let's look into this. So I cracked open the meta-analyses that they were referencing, and I was like, okay, so it's saying very specific things about vitamin D1, and then 2, if we actually look at the papers that these are referencing, there's a lot of secondary outcomes that were amazing. So
let's talk about these outcomes, because I guess our goal with this video is to help dissipate some of the confusion that these sorts of reports create for patients who are out there. And this goes on all the time, where patients will come in and say, I don't know if I read about this or I Google about this and it says yes here and it says no here. And so at the end of the day, they just don't even really know what to take. And so sometimes they just don't take anything. So when it comes to vitamin D, especially where we live, the latitude that we live at,
the angle of the sun.
We're above the 49th parallel,
we
right?
Get that nice UV wavelength we need to synthesize vitamin D.
That's the only way that we can have vitamin D in our system, is to have the sun shine on our skin. And it produces, so it's a hormone. Actually, vitamin D is a hormone, not a vitamin. And so let's talk about, first of all, what is the value of vitamin D? Why would we supplement with vitamin D?
Oh, lots of reasons. I mean, it's involved in cognition, it's involved in energy, it's involved in your immune system, it's involved in muscle strength, lots of things. Vitamin D is, like you said, it's a hormone, so it activates a percentage of your genome, so it's changing the expression of a lot of things.
And it typically is very deficient. This is one of those blood tests that I am pretty consistent at making sure we've optimized people's levels of vitamin D, because it actually is a relevant blood test when we're looking at nutrients. There are other nutrients like calcium, magnesium, and different things that we don't really get really good information just from testing your calcium in regular blood work. But when we test vitamin D and it's low, then we definitely know that this is something that we want to optimize. So, and we are moving in our demographic here and where we live, we're moving into the dark months. So we get a lot less sun, and we are prone to seasonal affective disorder and vitamin D. There's good evidence for vitamin D and SAD.
Seasonal affective, absolutely.
And so what was the big problem with the study?
One thing I'll point out about the study, actually less so about the study and more so about how it was presented, as saying that vitamin D wasn't beneficial to supplement, whereas the meta-analysis itself, if you look at it, says that that's only specific to fracture risk and certain bone density scores and falls. So it wasn't saying anything to do about the other benefits that we mentioned. It only said it had to do with those 3 things.
So basically it's saying that it's not going to increase your, decrease your likelihood of breaking a bone by taking with vitamin D.
They're saying vitamin D isn't going to change your likelihood of breaking a bone, falling, or increasing your bone density. Beyond a certain measure.
Right, and we were talking about this behind the scenes with Dr. Marcoux, one of our other doctors, and she brought up a good point, which is that vitamin D in isolation is not as effective as when it's combined with vitamin K. Because vitamin K is what helps direct vitamin D and help it do its job better.
Exercise.
So there's many other factors that play into the quality and the health of your bone.
Totally, bone's a living matrix. It's not just minerals. It's not just calcium and phosphates. It's this network of collagen that these things exist within, and it needs constant turning over to maintain the health of it. So without the collagen, without the protein component of your bones, you don't have strong bones. You have brittle bones, even though they might appear dense. So
what about the study, when you talked about the secondary outcomes, the benefits to vitamin D? This is what made us laugh, because
I was going through the individual papers that the meta-analysis was referencing, and some of them were good, and I just want to say, like, some of them, I would argue, didn't even reach an effective vitamin D range, but that's besides the point.
So they hadn't optimized the vitamin D status. They hadn't brought it up enough in the blood.
They were using a measure that we would say is still inadequate for their high dose. But anyway, so what was fun was it was a chronic care case with elderly patients, and they wanted to look at their fall risk if they were supplemented a reasonable dose of vitamin D. And they found that were doing pretty well actually with the high dose vitamin D
Yeah.
group. They felt better. They had secondary scores. I can't remember what improved.
They're respiratory.
Right, they had fewer respiratory infections.
Fewer respiratory
so it's assumed that
infections.
their immune system was more effective. But
Yeah.
a funny side effect was these people were actually falling more often with vitamin D, not breaking bones any more often, but they
Yeah.
were falling more often. And so it got us thinking, like, are
Yeah.
they just up and at it more?
They feel better. They're up. They're active.
Who
They're
knows?
not in bed convalescing with respiratory infections.
Maybe.
So they're up. Maybe they fell more, but they didn't break anything. So
Yeah, so
you know,
it was just a funny little secondary.
Yeah, we were
you know.
just sort of reading into that. But
Yeah.
anyway, so the takeaway message here is that there is still lots of value to supplementing
vitamin D.
with vitamin D3.
Yeah, vitamin D3.
And we typically always combine vitamin D supplementation with vitamin K.
Mm-hmm.
Both are fat-soluble vitamins. Really hard to get from, well, you can't get vitamin D from your diet unless it's been fortified in milk.
There's some in eggs and things,
Yeah.
but not a lot.
No, and certainly if you live in a sunny environment, then yes, you likely don't need to supplement as much. So, yeah.
Yeah, and I'd say vitamin D is still beneficial for a myriad of other things. And even if it doesn't decrease bone risk, the question that we have to ask ourselves is, what's the cost of taking it versus not taking
Yeah,
it? And I
yeah.
think it's so affordable
Yeah.
that why wouldn't you take it?
Well, and because of all these other ways in which vitamin D actually, and I see this clinically all the time, people feel better when we optimize their vitamin D
Yeah.
levels. So.
That being said, you probably shouldn't be pounding large amounts of it either.
Right,
but,
without
but
having
yeah,
your levels tested and
Absolutely.
doing it safely. So there we go. We hope that helps.
Great.